congratulations and my thanks to the ISACON 24 Patna, and my thanks for giving this opportunity. Now the best compliments from my place of worship. This is Medical College of General Hospital, Patiala, Punjab, 1600 bed hospital. I must share something about the hospital, that this is a hospital where during pandemic there was not even a minute of, where there was a lack of oxygen. So my topic is on the Celeste maneuver, the current evidence. Now while we will be going through this current evidence, we will be walking through a bit of the introduction, a bit of the historical background and how it acts, the techniques, the devices, and how the training is must, and a bit of the pros and cons and indications and the contraindications. So what is Celeste maneuver? This is, we all know, this is an extended pressure to the cricoid cartilage to prevent gastric contents leaking into the pharynx while we are doing the obstruction of the esophagus. The esophagus is compressed between the cricoid and the C5 and 6 vertebra, and this is performed by an assistant before and how the duration, which is very important, that at the start of the induction to the inflation of the cuff. So this is a beautiful diagram where the cricoid pressure is given on the cricoid cartilage by thumb and index finger, and you can see the esophagus is being compressed. Now, this is actually the platform where we can pay homage to this great anesthesiologist known for the Celeste maneuver. And actually, it was in 1946 that Manson who emphasized that there is a aspiration pneumonitis during face mask ventilation in ops anesthesia. And 15 years later, the Celeste reported the use of the cricoid pressure to prevent the gastric contents. Now, for the JRs, for the PGs, the question in the quiz that what are the other contributions? So it's a positive pressure ventilation and cessation of the smoking and hypothermia, the other important projects of this Barian Celeste. So how it acts? It was because this is on the recent evidence. So actually it was thought that the Celeste maneuver acts by esophagus is compressed between the C5-6 and the cricoid cartilage. But the retrospective studies and the CT scans showed that actually the esophagus is not posterior to the cricoid cartilage, it is posterior lateral and it is more on the left side. So by giving direct compression, we are not probably solving our purpose. And actually it is a hypopharynx which is compressed and it is not a esophagus. So what's the importance of this? That the importance is that even if we are applying the parapharyngeal pressure, so the Celeste maneuver is done, that is, we are avoiding the compression. We are avoiding the aspiration. So parapharyngeal pressure may achieve the desired compression at the esophageal level. And one thing more, that even the inappropriate pressure will also act. So how much cricoid pressure prevent the regurgitation? Now it was by the Celeste, it was told the 30 Newton. 30 Newton means 3 to 6 kg. Actually this we say the cricoid pressure. So it's the cricoid force which is more important, because one thing very simple, that we are talking of the pressure, but we are talking in newtons, and the newton is for the force. So it's a recently we said it's a cricoid force, not the newton. And by the Celeste, it was that you start from the 30 kg only, 30 newtons only. But 30 newton pressure is not tolerated by the patient, so there is a retching, even the vomiting can happen. So we start from the 10 newton, that is 1 kg, and we increase it to 30 newton. So how, yes, now for the, once we talk about the pros and cons, for those who say that vomiting occurs by cricoid pressure. So why this vomiting occurs? Actually, once we are applying the Celeste maneuver, we are stimulating the mechanoreceptors in the pharynx. So that is actually, we are monitoring the swelling. So we that's why the vomiting can happen, because we are stimulating the mechanoreceptors. So this is a technique. Now originally by the cellist, it was that the head has to be extended, so as to, because that will cause a stretching of the esophagus and it will be compressed. But currently the clinicians are in agreement that cricket pressure can be done in a sniffing position, where there is a flexion of the neck rather than extension. And by this position there is an optimal laryngeal view also. So this is a one hand technique. By the right, on the assistant is standing on the right side, and in the double hand. So here the one hand, the left hand is below the neck. The plus point for this is that you are fixing, you are causing the immobility of the neck, especially when there is a cervical spine injury. Now, yes, because 30 Newton force, it's very difficult to maintain throughout the procedure, especially when there is a difficult intubation. So, the studies have shown that fatigue happens before that, and but most of the time the intubation can happen in less than 3.5 minutes. So, if that comes, the fatigue comes into action, then 20 Newton force will also help, and the assistant can continue for 9 minutes. So the devices, now actually what happens, there is a, still we are talking of the cellist maneuver, but still there is a lack of the skilled assistance. So we need to have the devices for this cellist maneuver so that it can be